Hello everybody, welcome back to our channel. I'm Julieta Guzman, head athletic trainer here at Avid Sports Medicine, and in this video, I'm going to share my thought process when designing a soccer injury prevention program. Before we get started, I wanted to remind you all to like, comment, and subscribe to our channel for more videos on all things athletic training, sports injury rehab, and strength and conditioning. What is injury prevention? If you're watching this video, it is likely that you are either an athlete yourself, you coach athletes, or maybe you're a parent to an athlete. As we all know, the field of athletics can be very unpredictable. And when you've spent your entire career as an athletic trainer like myself, you learn to prepare for the risk of injury. With that said, since we know there's always a potential for injury, one of our primary goals with sports medicine is to reduce the overall likelihood of injury. Meaning that if we can teach an athlete how to not only move, but also recover more efficiently, we can minimize the chance of that athlete getting injured, or at the very least, minimize the chance for that athlete to incur a severe injury. So in this series, you will see 4 types of movement used for athletic development to decrease the chance of sustaining an injury. These movements are categorized as mobility, balance, strength, and agility. And as we dive into examples for specific movements into each of these categories, we're also going to discuss how we organize these movements in the program as well as the value in each of these movements. Let's start with mobility. One of the leading causes of most musculoskeletal athletic injuries can be traced back to a lack of joint mobility. Mobility can be defined as the ability to move easily and freely through a joint's full range of motion. So if I have, for example, an athlete who has an inability to do a simple task such as touch their toes or maybe perform a proper squat, it is quite possible that they're limited in their ability to move freely in their back, knees, hips, or even their ankles. So in order to improve joint mobility, I'll always include in my programs a few key exercises specific to the athlete that can be done outside of practice and competition. Here's a staple mobility exercise for the ankle called controlled articular rotations, or as I like to call them, ankle cars. You can see in this video my associate athletic trainer Liz is starting in a seated position, and as she lifts to support her leg, she begins rotating her ankle inward and outward for a few repetitions. Adding this exercise in warm-ups will activate the inside and outside of the foot, as well as the surrounding ankle muscles to stabilize and protect the joint during hard cuts and fast turns. Maintaining range of motion with ankle mobility exercises is one of the most effective ways to reduce the chance of sustaining common ankle injuries in soccer. Next, moving on to balance. Now, after mobility, I'll start to think about balance. And not just balance in the typical sense like standing on one leg and holding, but also in the sense of muscular imbalances between comparable structures, such as hamstring versus quadriceps muscle recruitment. On one hand, balance exercises are specially designed to complement the athlete's proprioception, meaning if the athlete can develop a better sense of body awareness for where they are in space, their ability to react to sudden moments of instability will improve. On the other hand, if I isolate the body using unilateral exercises, think about left side versus right side, I may determine one side to be more dominant than the other, and in turn work on achieving near equitable, if not equal, ability on each side independently, which would in turn give me a stronger, more capable structure and more functionality when both sides come back to operate together. In this clip, Liz is performing an RDL. You may recognize this movement as a hamstring strengthening exercise. However, there's also a great deal of balance occurring here in the planted leg at the hip, knee, and ankle. The key to this exercise is to stabilize the core. The core here consists of the abdominal muscles as well as the gluteal muscles. You may have heard the cueing, squeeze the butt, squeeze the gut. And I should also mention that foot control is another major factor in this exercise. You'll see now from a sagittal view that she's maintaining a slight bend in her knee, which requires a bit of quad strength and a nice flat back. Here's where the muscular balance ideology can be applied. And of course, she maintains a nice posture, no hunching or slouching there. Again, this exercise is meant to improve balance. If I find that the athlete has improved in this exercise, I don't have to immediately add weight to make this challenging again. I can always progress the athlete to an unstable surface like an Eric's pad Or maybe have the athlete close their eyes, because we know taking away these particular senses can create a significant disadvantage and in turn create quite the challenge. Moving on to strength, which is everyone's favorite thing to train because, hey, who doesn't want to be stronger? I'll start by saying that strength is tricky because it's obviously necessary to be successful as an athlete, but it is also very easy to be limited in strength if, as an athlete, you don't have a solid foundation of mobility or stability. With that said, strength is the third in the lineup, and when it comes to strength, you can make significant gains, especially in novice or untrained individuals with little to no resistance, which is why I'm a huge advocate for bodyweight strength training to start. It's low budget, valuable to learn, and if an athlete can't move efficiently with just their own body weight, they shouldn't even be thinking about picking up an external weight. So here we have one of my absolute favorite staples, the walking lunge. You'll also see this lunge includes a twist to get some extra trunk mobility in the mix. And if you know me, then you know I'm going to squeeze that mobility aspect in wherever I can. So you can see here, a classic exercise like the lunge will not only strengthen the glutes and quads, which happens to be a great complement to the RDL, but it'll also strengthen the core as well. So when you think about strength, think about challenging yourself physically. If that doesn't require weights, then by all means start with the body weight. When you master your body weight before moving on to kettlebells, the dumbbells, the barbells, all the bells, you'll be better equipped later down the line because of it. Moving on to agility. The last movement category we're going to touch on is agility. And you may be thinking to yourself, yes, I want injury prevention, but I also want sport specific. And I totally support that. Sport specific is important, but it's also something that most coaches train for with their athletes already. So I like to throw it in there at the end of the program to reinforce sport specific movement, but also to give the athlete a chance to work on their agility without having to simultaneously worry about handling an implement, and in this case, that implement would be a soccer ball. So here in this video, we can see Liz doing a toe tap on a stationary medicine ball. Our objective is to engage those fast twitch muscle fibers that will prepare us for the increased intensity that mimics gameplay activity. And you can see she's getting her arms involved. Hip flexors are firing, core, glutes stabilizing to keep her relatively in place as she lifts her legs to tap the ball in a controlled manner. Sport-specific agility exercises like these are best to incorporate immediately prior to ball handling drills. That way you've warmed up your athlete and they're ready to play. With that said, coaches should note that agility drills should be handled differently. That is, we want to make sure we do them during or immediately before practice as opposed to balance or strength, which would be better to focus on during off-field days. Remember, mobility serves as our most fluid activity and should be consistently reinforced both on and off the field. So there you have it, the elements to my method of creating a soccer injury prevention program. I hope this video was helpful to you as a coach, parent, or player, and if you'd like to know more about how we at Avid Sports Medicine use movement for athletic development and injury prevention, you can visit our website at avidsportsmed.com or send us an email to info@avidsportsmed.com. Thanks again for watching our video and good luck with your training program.